Quickly look at the clinical picture of anterior dislocation of the shoulder. Clinical picture of anterior dislocation of the shoulder. So it's just simple. It's just shoulder dislocation is shoulder dislocation. It's now divided into the one that the bone is dislocating and coming to the front. That's anterior dislocation. We also have the one that the bone is dislocating and going to the back. That's posterior dislocation. We have the one that the bone is dislocating and going down. That's inferior dislocation. But we're about to talk about this anterior one, you know. So this is how it could look like. So clinical picture is just more of like you look at how it is. Okay. So you could see this shoulder that is fine is rounded, while this one is flat. You can see the acromion process protruding so much. Show you that there's a dislocation there. Okay. So clinical picture is the general features is the patient will be complaining about a lot of pain in the shoulder. And if you ask them what caused it, they always relate the story to what an injury, a fall, accident, sports injury. So there's a deformity. So there's loss of the normal shoulder contour. So the shoulder, instead of being rounded like this, is flat. It's giving you some angle 90. Okay. So arm position. So can you see how this guy is using his hand that is well to hold the hand that is poised? Okay. Hold the hand that is injured. Okay. So restricted movement, of course, the patient is not able to use this hand that is injured like the way they used to use before, the palpable humeral head. So your humerus head is no longer covered with much bone, so you can easily touch it. Okay, so that's a clinical picture, and this is like a prototype. The patient is using his hand as well to support the other one. This side, acromion process is pointed, is prominent. The shoulder, instead of being rounded, is flattened. A prototype, okay, of how a shoulder dislocation will look like. So associated signs is if a nerve is injured, of course, the part of the body that nerve is supplying sensation will be affected. So axillary nerve, there's decreased sensation over the lateral shoulder. So you have a regimental badge injury. Okay, so to say, all those Boy Scouts, Boys Brigade, they put badges here, right? Army. So at this part of the body, you have loss of sensation. So they call it a regimental badge injury. So there's weakness of the deltoid muscle too. Then also vascular injury. Muscle spasms can be there. So mechanism of injury is usually by trauma with the arm abducted and externally rotated. Can also occur in older adults after a simple fall. Okay. So examination findings is if you look at the shoulder is flat and the acromion process is kind of like pointed out. The palpation, if you touch the head of the femur, you can touch it easily. So range of motion, you're not able to move very well again. They always do neurological examination to look at the nerves affected and of course the parts that they supply to look at how the situation is going. Then also you access for the blood vessels to see that there is no compromise in the blood supply. Okay. So that's it for the clinical picture of anterior dislocation of the shoulder.